This portion of the news is brought to you by Inspiration Senior Living, where we provide affordable elegance to Pahrump area seniors. Give us a call at 751-2300 and make an appointment to tour our community.
The usual treatment of stage 2 or 3 rectal cancer includes surgery to remove the tumor. Traditionally, patients have undergone a major open operation to remove the cancer. A new study compared whether a minimally invasive approach would be as good as an open or full operation.
This health tip is brought to you by
Desert View Hospital and Mountain Valley Physicians Group. Don't put your health on hold. We have time for you. Call us to schedule your appointment. 775-751-7100.
This patient is undergoing a laparoscopy. The operation is done with small incisions, smaller instruments, and a fiber optic scope to see inside the abdomen. Most times the patient has less pain and a quicker recovery compared to a traditional open procedure that involves making a large incision. This technique works well for treating colon cancer.
Rectal cancer, which is at the other end of the GI tract, at the very bottom of the colon, is a different ball game. There is a high risk of local recurrence of the tumor in the pelvis after an operation, no matter whether you do it open or anything else.
Dr. James Fleshman from Baylor University Medical Center and co-authors wanted to know if a minimally invasive approach was as good as an open procedure for patients with stage 2 or 3 rectal cancer.
We wanted to make sure that we were giving our patients the best chance for curing their cancer, not just giving them the advantage of a small incision and a minimally invasive approach.
486 patients were randomly assigned to receive a standard open operation or the minimally invasive laparoscopic approach. All the procedures were done by 46 highly trained surgeons. Specimens from each procedure were examined under a microscope to see whether the entire tumor was removed, known as a complete resection.
Patients who underwent an open operation, 90% of all the patients had the complete resection. In the laparoscopy group, only 81.7% of patients ended up with a complete resection. That told us that laparoscopy for rectal cancer was not as good as open operation for rectal cancer.
Dr. Fleshman also says tumor location is important.
So if this is a very straightforward, small tumor and the surgeon is comfortable in stating that this will be able to be done perfectly, then laparoscopy may be the appropriate way to go. In a tumor that's very deep in the pelvis and very large, laparoscopy may not be the right way to treat this anymore.
Catherine Dolf, The JAMA Report.
Thank you, Catherine. This study is one of the first trials to evaluate surgical techniques for treating rectal cancer. Medics responded to a rollover accident on Manse near the entrance of Mountain Falls Friday night. A single vehicle rollover accident occurred on Friday night on Manse Road near Mountain Falls. Pahrump Valley Fire and Rescue and Nye County Sheriff's deputies arrived on scene. The vehicle that rolled was an off-road vehicle. 3 people were reportedly injured at the time of the accident, one with head injuries. Mercy Air was called to the scene, but shortly after was canceled. All declined to be transported to local medical facilities. A vehicle arrived on scene, turned the off-road vehicle back over, and then towed it home before the accident investigation was completed by Nye County Sheriff's deputies. The road was blocked while the investigation was being conducted. And Fire Chief Scott Lewis explains this morning's vehicle versus structure accident that occurred at Smith's.
This morning we were dispatched a report of a vehicle versus building. We arrived on location and found that there was superficial done to the large commercial supermarket structure. However, the vehicle did sustain some damage. There was refusal by action. The person didn't want to be treated medically and left the area.
And then you didn't have to check out for structural damage, or it was apparent that there was none?
We did a quick assessment and found that there was no significant or substantial structural damage to warrant any further actions from the fire department.
Do you know why the accident occurred?
It's unknown at this time.
40-year-old Donnessa Harden of Las Vegas was arrested for possession of drugs, a hypodermic device, and a pedestrian walking on the wrong side of the highway. Police witnessed the female walking northbound on Homestead Road in traffic and made a pedestrian stop on the female, later identified as Donnessa Harden. During the contact with Harden, she was observed to be very jittery and her eyes were dilated, according to police. She allegedly admitted to injecting meth earlier that day and also used marijuana. She was arrested and transported to the Nye County Sheriff's Office Detention Center. More news when we return.